Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Stereotactic biopsy of a brain lesion, Frameless introduction. Surgeons often find a problem in a patient's brain but cannot tell the exact cause or nature of the problem from initial tests. So that your doctor can get a more accurate understanding of your problem, your doctor may order a stereotactic biopsy of a brain lesion. The decision whether or not to have this surgery is yours. There are many ways to perform a stereotactic biopsy. This module discusses the biopsy that does not use a head frame attached to the skull. This patient education module will help you understand the benefits and risks of this surgery. Anatomy. The brain controls all body functions, from speech to movement and thought. It is located in and protected by the skull. MRIs, magnetic resonance imaging scans, and CAT scans, computed axial tomography, are routinely used by doctors to look at the brain. This is an MRI of a normal brain. Symptoms and their causes. Brain lesions, or damage to part of the brain, can affect the function of the brain. Patients may have personality changes, headaches, weakness, vision problems, and other symptoms. An MRI or CAT scan could reveal lesions responsible for these symptoms. These lesions could be benign or malignant tumors, sites of infections, or other inflammatory diseases of the brain. Getting a biopsy of a lesion or removing a small piece of it and studying it under a microscope could help determine the exact nature of a lesion, such as its causes and what it is made of. It is also very helpful in deciding future treatment. This is an MRI of a deep lesion in the brain. Biopsies of deep lesions are sometimes better done with a needle. This saves the patient injury to the outside areas of the brain. The operation is performed through a small hole in the skull the size of a dime. In most other cases, such as with a tumor, an operation known as a craniotomy is needed to determine the exact nature of the tumor and to take out as much of the tumor as is possible. A craniotomy is performed through a large incision in the scalp and a large opening in the skull. The pathologist looks at the tumor under the microscope to help decide whether it is benign or malignant and whether any other treatment is needed.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Other treatments. The origin of brain lesions needs to be determined prior to treatment. Sometimes, a history of cancer or infections may help the surgeon determine the nature of a brain lesion. MRIs and CAT scans can sometimes determine the nature of a lesion. In the cases where the nature of the lesion cannot be determined, a biopsy may be needed. A biopsy is a surgical act of removing a small piece of the lesion for study. More lesion or lesions may be left behind because taking them out may be too dangerous or unnecessary. Once the nature of the lesion has been determined, further treatment can be started. Radiation therapy or chemotherapy may be needed for malignant tumors, and antibiotics may be needed for infections. Procedure. This operation is usually done under local anesthesia or numbing of the scalp, an anesthesia much like the dentist uses to numb teeth. Taking a biopsy of a deep brain lesion using a needle is known as stereotactic biopsy. Stereotactic means accurate localization of the abnormality or target in space, much like we identify cities on Earth using longitude and latitude measurements. There are many ways to perform stereotactic biopsy. This module discusses the biopsy that does not use a head frame attached to the skull. Recent technological innovations have allowed surgeons to pinpoint the exact location of a brain tumor at the time of surgery. This technique is known as frameless stereotaxy or image-guided craniotomy. Before the operation, your surgeon may repeat your MRI or CAT scan after sticking small markers on your head. The markers are not painful. Some frameless stereotaxy systems do not even require the placement of markers. The MRI or CAT scan images taken before the operation are more detailed than regular MRI or CAT scans. They have many more images with much smaller slices. Your surgical team enters the data from the new MRI or CAT scan into a very powerful computer. In the operating room, special probes interact with the computer. They help to pinpoint the location of any structure seen on the scans of the patient's head. This technique allows an easier, faster, and safer localization of tumors. Tumors are accurately located whether they are at the skin level or deep in the brain. Frameless stereotaxy also allows the neurosurgeon to tailor the scalp incision to the exact location of the tumor. The neurosurgeon clips the hair at the site of the small incision. Numbing medication is then injected. The skin is then opened up, and a hole in the skull the size of a dime is then drilled, and the needle is advanced to the site of the lesion using the data taken from the computer. This is a very precise operation. Once the lesion is reached, the surgeon takes small pieces of the lesion through the needle and sends them to the pathologist for preliminary examination. Once the surgeon and pathologist are satisfied that they have enough pieces of tumor to reach a diagnosis, the needle is removed and the skin is closed. The operation is not painful. During the operation, the surgeon monitors the neurological function of the patient. The patient is intermittently asked to answer questions and move his or her arms and legs. Rarely, this operation may need to be repeated if the pathologist is not able to come up with a final diagnosis. Risks and complications. This surgery is very safe. There are, however, several possible risks and complications. These are unlikely, but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to any type of surgery and others specific to this type of surgery. These include, but are not limited to, stroke, heart attack, pneumonia, and blood clots in the legs. These risks will be discussed with you in greater detail by your anesthesiologist or nurse anesthetist. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes, the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deeper at the skin level. Deep infections may involve the brain or the fluid that circulates around the spinal cord and brain. This is known as abscess or meningitis. Treating deep infections may require long-term antibiotics and possibly surgery. 2. Bleeding, either during or after the operation. This may, in extremely rare cases, require a blood transfusion. 3. Skin scars. Other risks and complications are related specifically to these procedures. These are also very rare. However, it is important to know about them. Strokes and hemorrhage inside the brain could lead to paralysis and even death. This is rare. Another operation may be needed to remove blood clots that can occur after the operation. After the surgery, patients may spend a day or two in the hospital for close observation. Once the final pathology or nature of the lesion is determined, your doctor may specify other treatments.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Stereotactic biopsies are very safe and successful in determining different types of brain lesions. This operation is very safe. Risks and complications are not frequent. Knowing about them may help you detect and treat them early.
Thank you for using Explain.